We can have altered levels of leptin and neuropeptide Y in PTSD. Generally speaking, we're seeing an increase in leptin and either an increase or decrease of the NPY based on PTSD or metabolic syndrome. But eventually we see, again, kind of this convergence. So in this article, the ones that were discussed as far as systemically throughout the body was leptin. Remember, that's our fullness hormone that is such an underrepresentation of what leptin does, but we think of it as our fullness hormone. It acts on the hypothalamus. Again, these are all interacted, right? So it's acting on the HPA axis, right? The normal duties of leptin is to suppress appetite, and then it directs energy storage and moderates energy metabolism. So in PTSD, studies seem to indicate that we have an increase in leptin that may potentially be causing leptin resistance or be a result of leptin resistance, if that makes sense. So if you're not familiar with this idea of leptin resistance, essentially what we're seeing is that it leads to a dysregulation of appetite, and then we have an adaptive reduction in energy output. So these individuals feel hungry, but they're not utilizing their energy appropriately. So this leptin is starting to store more than it should, if that makes sense. They do tend to gear more towards increased sugar cravings rather than just hunger in general. And then animal models indicate that when leptin is utilized appropriately, it helps squash the fear response. And when we have that resistance, we don't have that, even though we may have higher levels, we're not responding to it. So we don't have quite the ability to go, we actually don't need to be scared right now. Neuropeptide Y is one that I don't think as many people are as familiar with, but it acts as a neurotransmitter, so similar to like dopamine or serotonin, and a neuromodulator. It does all kinds of things. So you can see all of that there, but typically what we're seeing, or why we're talking about it in this, is that it is responsible for reducing anxiety and managing stress, right? It's distributed by the central nervous system, the hypothalamus again, and then the peripheral nervous system. We can increase NPY expression with protein or energy restriction, right? Which in turn can make the individual hungrier. And it gets kind of hairy because, like, okay, if it is increased, we can manage stress, then we should like do energy restriction to like help them manage their stress, right? Because that makes the NPY higher. It doesn't work that way. None of these things are as black and white and clear cut and straight line processes as that sentence makes it sound. So in PTSD, we actually do see lower levels. And so they do have lower stress resilience and higher anxiety at baseline, as expected by saying we have lower levels of that. In metabolic syndrome, we do have a higher level of NPY, but that increases food intake and fat storage, reducing energy utilization, which can also make them feel poor in some manner, a little sluggish, a little slow. So this isn't a case of more is better, less is worse, right? They do a lot of different things. So you just want to make sure that, we're not kind of giving off this impression that like, oh, energy restriction makes this go up, so just don't eat enough, right? Like that's going to backfire. It's also going to mess with your leptin levels if you're not eating enough. And so then you have, another or a more exaggerated problem that we had up there by doing that. Or just, y'all are dietitians, make sure your client's eating enough. That's first. Insulin was discussed. In PTSD, insulin is mildly elevated, and it elevates more in response to carb take than in somebody without PTSD. So we do see insulin resistance related to PTSD with or without actual diabetes.